So, it's very true. But to create better balance, we need to add volume in the chin area. Also, I think that we're going to widen and define the jawline. We're going to reduce the thinness of the face by adding volume in the mid-face. And then finally, to create a better balance for the nose, we're going to add volume here, here, and here, with the entry point here. So to frame the face, mid-face, jawline, chin, and nose. When attending to the mid-face, we discussed this earlier, we have the malar fat pad. Behind the malar fat pad we have the pre-sigmoidal space. If we inject into that, she will have a natural smile. She will have a natural augmentation. So to reach that, the easiest way is to go lateral, through the skin, like that.
We'll make it oblique.
Same direction as I move with my candula, right? I will then lift this up, gently find that pre-sigmoidal space. Here, hold the hairnet. Because I don't want that here.
Pre-zygomatic space.
Pre-sigmoidal space. So once I reached it, like now, you can see it moves freely. No resistance, right? So when she will smile, the smile will move freely. It will not look strange or artificial. If we do
more
superficial injection like here, smile, it will move with the filler, right? So the point is to go deeper. It's a natural space, so we will not have migration anteriorly, laterally, inferior or superior. We talked about this earlier, I don't know if you were here, about making treatment plans for our patients, right? So when we do fillers, we have a building up phase. We want to build up the result. Of course, it takes more visits, more syringes, more needles, more money. Now, this patient has a wedding in 1 month. So we have to hurry up, and that's the reason why we're going to do a lot today. Otherwise, we would have divided the different treatments, right? So once again, we lift it up.
This is Perlane.
This is Perlane, yes. Small migration, you can see that? But it still doesn't move, right? So what we need to do, you see, is fixate it. And we create a smooth mid-face implant. 1.5. Made a lot of difference for her, right? So my suggestion is we will treat this side and this, and then we do that, okay? Are we happy with that shape?
Yes.
Or does she need more?
Enough.
Enough. Very good.
نسيم المكان ده. الله يخرب بيتك.
So here we have two choices. Either we go really deep on the bone, on the other side, or we go subcutaneous. If we're subcutaneous, we need to have some tissue support. I mean, she's very, very thin, right? And we want visible result of the filler, but we don't want visible filler. That's two different things, right?
So you put it on deep on top of one?
That was 0.5. We're going to need one more.
قلت لك المكان اللي جدا يجي يحط
And I try to hold my syringe very gentle to find the right layers for injection, right? You feel that it's quite deep, right?
Make a reflection.
Anyway, it's a linear injection or fanning as we always do with microcannulas, but I'm not thinking lines, I'm not thinking fanning, I'm thinking creating a shape that I want to have.
Now you're doing the line?
It's always linear with the microcannula, but it's also a combination of depot techniques. So now I want to go up here, right? Either I have a new entry point here, or I will just push it up like that. So now I'm over here. You can see that gel coming there, right?
Yeah.
They do. And suddenly we have created some shape there.
There is no need to use this area in between.
No, this area is very small support. So if we want to create the shape to the face, a feminine shape, we want to avoid injecting too much here. Of course, some patients, they have hollowness here. And then we can add a little bit, but there's, open your mouth. There is no support here, so we have to be gentle. The point here is to create a better bone structure. So we add volume here, here, and the next step would be the chin, and then the nose. For chin, we have basically two techniques. One is perpendicular, the other one is going from a lateral approach inside. Perpendicular, we cannot really control the level of injection. The injection will end up in the submuscular space, into the muscle, but also subcutaneously. And if I feel this chin is really, really tight, so there's a limit to how much volume I can put in there by perpendicular technique. If I want to add more projection without having visible filler, because we don't want to have that, then I have to have a lateral approach, and I can go subperiosteally, because in the subperiosteal space, the gel will be contained and it will not be visible, but the result will be visible, right? So we're going to combine the both, right? First, we will start with the perpendicular. So we find the midline. Is the lightning good, Ahmed?
Yes, good.
Okay. So I'm resting on bone. It's a little bit painful in the beginning, but the Perlane will numb it immediately.
Here you are on top of bone.
I'm on bone, I'm resting on the bone. You can already see that it's still contained. It's not subcutaneous yet. It's a very small, tight chin. So we have to do the combinational treatment. You can feel that it's So the next step, could I have a big gauze, please? Is to create a better shape for this. And this is what I call the Korean technique. I picked it up in Korea. So what we do is we use a gauze to create a nice, smooth, pointy shape of the filler, right? Relax. She's putting tension to her mentalis, but you see, now we have a nice projection. But in my opinion, she needs more. She needs more bringing it in. So now we're going to have the anterior, the lateral approach, right? Then we will turn your head. We could use the same entry point, but that entry point is that direction. So if we're going to use that, I have to go in and then turn like that. So instead, I'm just going to make another one. So here we also have different layers of injection. If I'm subcutaneous, I'm above the DAO, right? Then we could go deeper. Let me show you. Like that. So now I'm behind the DAO. If you look now carefully when I retract, you saw that snap? You saw the difference? Now I'm above DAO. One more time. Underneath, 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 underneath. Snap and above. Right? Above. So what we want to do is we want to have support, of course. So I go deep. I'm now on the bone. If doctor, you want to feel this, you can feel that it's subperiosteal over here. You feel that? Here. Just as we did with the tear trough previously. And I'm now also including the lateral part, right? Having support of the full chin. Of course, we need to do that on the other side as well, right? So now the projection is getting there. We need to fix the nose. Finish the chin and then we'll do the nose. Entry point. We're going to reach that deep layer. So here she has not been injected, so it's much more painful until I started the first injection. And I really need to assure myself to be deep. I'm gonna need a big gauze. Perfect. Oh. So what we created now on a Saudi bride-to-be is a Korean chin by a Swedish doctor.
Very beautiful, mashallah.
Okay. Next step would be the nose. Okay. So entry point for the nose we'll have just in the tip. Because from here I can reach down here and I can reach all the way up. All right. Don't go too deep. Thank you. This is per lane and it's 25.
I had one trial with cannula, but it was only one trial with cannula.
Yeah, so
For
work
nose.
very, very gentle.
There is resistance.
It's a little bit resistance and you find the fatter deep layer and there is less resistance. So now I'm on the bone. I need to go behind the muscle. It's a little bit painful. So I raise, I push it down because this is a safe area, but it also gives support of the filler because I don't want the filler to be moving around, right? You can see that it doesn't move. Giving support in that upper part, a little bit more to straighten out that dorsal. And then we will continue, and my markings, we know that she needs more projection here, right? We need to try to push up that tip to create more of a ski slope dorsal. But we cannot do that only from here. We need to go down here also. So now open your mouth, breathe through your mouth. So I go back. Open your mouth. And then all the way down to the bone. So now we're resting on bone, on the spina of the columella. So I will number. Could I have another mic candle? Anyone? Old one?
Old one?
Just to anyone. Just give me a mic candle. Once again, we need to understand where we are located, and you can see how deep we are. Right, so we're on the bone, right? And this will give support and push up the tip of the nose. I will also inject in the septa, which will open up that nasolabial angle. Some cream. So almost.
Done.
Almost. We need a small touch-up. So that was one entry. We'll change the proportions of the nose. There's only one way to make a nose smaller. You know how? Is to make the chin bigger. But then we can also change those proportions.
Excellent.
Yes, it looks good. The combination of the volume here, here, and behind pushed that sad nose up. We added volume here. This is her own. I think I would like to add a little bit more up there just to make it perfect. Now you're allowed to open your eyes because you will feel nothing. It's a promise. It's very important to have that deep injection. All the way down to that bone, create some structure. That's it. Using some cream, create a perfect shape. So now we've done nose, we've done cheek, we did jawline, we did chin on her right side. So let's please set her up and try to have an evaluation.
Magic. لا تعالى هنا. ولا
So added the volume here. We change the proportions of the nose and the face.